Good afternoon, everybody. I will call the meeting of the Social Connectedness Task Force to order at 11:34. Roll call, please.
Commissioner Loops,
Here.
Commissioner Cowell,
Here.
Commissioner Nelson.
Here.
Madam Chair, you have a quorum.
Excellent. Next up, we'll do the approval of the minutes. Are there any corrections to the minutes of the previous meeting on May 28th? See none. We need a motion to approve the minutes.
So
Motion by Commissioner Loops.
Support.
Support by Commissioner Colwell. All those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carried. Alrighty, moving on to the next portion, approval of today's agenda. Are there any changes or corrections to the agenda? See none. We need a motion to approve the agenda presented. Motion by Commissioner Loops. Support Commissioner Colwell. Thank you. All those in favor signify by saying aye.
Aye.
Opposed? Excellent. Motion carried. Next up, we'll move on to our public comment. Is there anyone from the public who would like to address the Social Connectedness Task Force?
Currently, you have no one on the public comment line.
Excellent. Thank you so much. All right.
Welcome.
Seeing none, I will close public comment. Alrighty, moving down to our first and only agenda item. Our only agenda item is to really discuss and talk about the grant framework proposal. Over the past couple weeks, I appreciated all the input that we got from members of the task force, including, taking a look at some AAA 1B survey results. And what we've done is given all the things that, we've heard from the task force, in addition to hearing from the survey results, we've compiled a document. And Barbara, can we get ready to share screen on that?
Yes, ma'am.
We compiled a document that really took all of the ideas and the suggestions, and we put them into 5 different categories. And the idea behind putting them into 5 different categories was to really take a look at putting them into categories that we could look at doing a separate grant proposal for. So as you see, the 5 grant proposals are our senior centers, technology, small businesses, nonprofits, and wellness and health programs. One of the things I would like to do is just briefly go through each one of those grant proposal frameworks. And if there's any questions about some of the things that we've talked about, I know Barbara did an amazing job kind of putting some ideas and thoughts together that we got feedback from in previous task force meetings in a document. And kind of what we did is we used that document to kind of try to fit all those ideas into 5 different areas. So like I said, let's go through each one of those areas. And if you feel that there's a questionable area of a suggestion that was previously thought of, please, whether it's just, you could say, I just want to verify, did, the assurance calls fall under that category? So please do not hesitate to ask those questions. And Barbara, I'm going to ask a quick question for you. Given that we have a shared document on the screen, it does make it a little bit more difficult for me to see wait, if I make everybody smaller. So if I miss somebody raising their hand, please just shout out on the mic, because your pictures and icons are now very, very tiny. But I also want to make sure everybody is accounted for. Alrighty, so as we go into our very first one with our senior centers. So number 1, assist with expenses, tailoring their programming for social distancing requirements. I think we heard previously with Chief Deputy Chambers, kind of talked a little bit about the CARES Act and what really is reimbursable and what is not. And rest assured, we are going to be taking a further fine-tooth comb at the ideas and suggestions within each of these categories to get more insight and clarification on, in fact, are these ideas covered under CARES Act monies? What we did recognize as we put together these 5 different categories, there will be some things that we talked about that are not going to be reimbursed through CARES money. That doesn't mean that we're not going to be looking at implementing those solutions. What it truly means is we need to act on the things that we can do now with CARES money Act reimbursements. So as you know, I think we said in the very first meeting, we're going to take a look at some of those short-term goals that we can execute immediately. There's going to be some intermediate goals, and then there's going to be some long-term goals. But rest assured, we are going to start first with looking at those things that can be reimbursed by the CARES money, because we do have a limited time frame between now and December 30th. So as we go through some of these things, just kind of keep that in mind. It's not that things aren't important or at a priority or not. Unfortunately, we've got money on the table that has to be spent in a specific time frame. Does anybody have any questions before we go into each one of the 5 grant proposal frameworks? Okay, I don't think anybody does. So if you do, please speak now. Okay, excellent. So as we go into the first one, our senior centers assist the expenses to tailor their programming for social distancing requirements. A good example of this would be, I know I had the West Bloomfield Senior Center reach out to me, and they have started to implement over the past month and a half, programming that utilizes Zoom. So costs that potentially have occurred through putting some of their services online and on a digital platform is most likely going to be able to be reimbursed through our CARES Act monies. Does anybody have any questions, comments, feedbacks in that very first senior center framework? Yes,
Kristen?
I see. Is that?
I have a question.
Go right ahead. I see ya. There seems to be one. Is that Commissioner Colwell?
Yes, thank you. I was speaking with the director of our White Lake Senior Center, and the Zoom and everything is a great idea, but a lot of the seniors still are not comfortable with this platform. And I had mentioned, well, we all have our local cable, stations that, you turn on the channel and it's got like the government or the school things on there. And I thought, it'd be a great thing to utilize those channels to have some programming and some outreach to the seniors. And then I thought perhaps we could approach the various, depending on who in each area, perhaps Comcast, perhaps WOW, perhaps whoever is providing that, those local cable stations, to see if we could get some grants there to help set something up for the seniors. Kathy was saying that the seniors they've been doing well in general. They're incredibly bored. They're lonely. They want to come back and have their yoga classes and play bingo and do all that stuff. So, but I thought, it might be a more friendly way to reach out to the seniors and something in a format that they can understand and relate to better. So I thought I'd just toss that out there.
Absolutely, I love that. And it looks like potentially that could fall under our nonprofits grants with that, in addition to our senior centers. So as we go through these lists as well, you are going to see some overlap. Rest assured, we have a great team going to be working behind the scenes to help, look at what categories are going to be best suited for these specific initiatives. But Commissioner Colwell, I couldn't agree more. Zoom isn't the only answer. There are many other platforms, and I absolutely love the idea of trying to capitalize in on some of our local civic center TV stations as well. Does anybody else have any questions, comments in regards to the senior centers?
Yes. Yeah, this is Jim. I'd like to ask if it will also include outfitting the senior center facility to be a safer environment for preparation for reopening, purchasing things like plexiglass, making the facility more touchless.
Absolutely, 100%.
Thank you.
Is that Cam?
Yeah, it's me. I can't get away. The thing that, I'm hearing a lot of good stuff. The thing that we're out here guessing what we need to do is send out some kind of a survey to our senior centers and ask them what expenses what is it that they're doing that they need to tailor their programming? Because
so Cam, love where you're talking, because literally what my goal is in the grant proposals that we're going to be creating, it's going to basically be an open door in regards to looking at what are the needs. And that way we can then further take a look at, well, does this qualify under CARES Act? So
Right.
when we do the grants, it's going to be a pretty broad grant. But absolutely, there will be going through those items with a fine tooth comb and really taking a look at, are those COVID money expenditures or not? So the
Right.
sky is almost the limit. And I'm a little hesitant saying that because the sky is the limit. But what's going to take place is really narrowing down to take a look at where the money was spent and can it be reimbursed through CARES Act money? And if it can't, then we need to know that so we could take a look at how much money are we looking at with our senior centers and other areas within the framework that potentially don't fall under. So I hear what you're saying, and at this point, it's going to be open for any of these 5 category organizations to really put in what they think could potentially be reimbursed.
Mhm.
Does that make sense?
Well, yeah, well, I'm hearing what you say, may think, some of these senior centers may not do some things because they don't think, in other words, don't even ask. So, unless you either give them some categories or what is it that they're doing? Right now, whatever they're doing may or may not be reimbursed. What they may potentially do on top of that is also in play, is what I'm getting at, is various senior centers have various capabilities. And like you say, in some cases, they might be able to utilize the local cable station if they have such a thing, or they may have their own studio, like I'm sure the Older People's Commission has. Okay. So what I'm getting at, Commissioner, is that a number of them are already doing some things that may or may not be reimbursable. And there may be some additional things based on what's coming out of the senior centers that one senior center is doing that another one isn't, that could also be in other words, how big is their toolkit? We really don't know yet, do we?
Absolutely. No,
Okay.
that's a really good point. And I think one of the things that, was made very clear is there's a lot of really great things happening. It's taking a look at, many people don't know, many places, senior centers and organizations don't really know that those things are going into play. And I know one of the things that we talked about was taking a look at doing direct mail pieces to the homes of seniors and even our senior centers to let them know, hey, these are already programs that are up and running. I think we all can agree it's not so much the 100% mindset of recreating the wheel. I think that there's great things already happening. They just need that financial support.
Right.
And in addition to thinking outside the box and coming up with some new innovative things. But Cam, you are exactly right in the sense of how can we make sure that people have the information that they need in regards to what is already being done. And what you're going to find is that's going to be embedded in these grant proposals of looking at doing some direct mail pieces to bring awareness and education to some of the things that are already happening in Oakland County.
Mhm.
Additionally, I know that Barbara had uploaded on the Google Docs site the guidance for the state, territorial, local, and tribal governments in regards to the CARES Act money. Whenever I've had people reach out so far to me about, well, really what's covered under, the CARES Act, I always resort to sending them that document because that document is provided by the Department of Treasury in regards to their interpretations and limitations to what the CARES Act really reimburses. And in addition to Commissioner Gershenson, actually, Commissioner Gershenson, are you on?
I am.
Can you provide a little insight on the information you heard about the webinars and really trying to help some of our local governments and organizations maneuver through?
Sure. So we want every expense that can be covered to be covered. And so Deputy Chief Hillary Chambers said we're going to be doing webinars once the applications go out, which hopefully will be next week, but maybe the week after. There's going to be questions about what's included. And that goes to Cam too, for his question related to senior centers. There will be an opportunity for everyone to ask questions, but also the underlying thought is get your applications in as soon as possible. I've notified all my communities to get ready, start tracking your expenses that are related to COVID so that your application can move a little bit quicker.
Excellent. Thank you, Commissioner Gershenson. And just to clarify, so there are a variety of grants that Oakland County is presently working on. And a large part of what Commissioner Gershenson was talking about was in relation to the Board of Commissioners. Tonight will be voting on our $30 million CVT, City, Village, and Township Grant CARES Act money. The process is going to be very similar to what you're going to see transpire specifically to this task force. But also, too, I just want to say that there will be some overlapping in grant applications. So the grant application that's going to come before the board tonight will, in fact, impact our seniors and a lot of the things that we're talking about right now. So again, as Commissioner Gershenson said, we want to get as much reimbursed as possible through the CARES Act. And, you know, we're trudging on some new territories with these grant processes, but definitely just know that there are a lot of grants being put out right now by Oakland County. It doesn't mean the things that we're talking about potentially aren't going to be incorporated in those grants. But at the end of the day, we will have specific grants geared towards the things that we're talking about as well. There's just going to be some overlap. Bottom line is, money is there to be spent on reimbursable COVID-related pandemic expenditures that have occurred. Does anybody else have any questions, comments on the first one? Okay, I believe, oh my goodness, I don't get names. Is that EJ?
It is. Thank you so much.
Excellent. Yes, EJ.
So when you mentioned the Zoom piece, I just had a couple of questions about it, and I don't know if it would be the technology stream or up there, but are we going to help with safe Zoom practices and documents about how to get into Zoom for people that may not understand it? And which stream would that fit in?
Absolutely. That's a really big component. At this point, I would say it falls under the technology piece because it's going to be paired with, you know, some of the other pieces that we talked about with technology, but that education and learning piece is significant. As you know, you've just said, it's important that we make sure that people are able to use these platforms, use their devices. So I absolutely think that there will be an attachment. There has to be an attachment of that education and learning piece. And one of the things that I'm a huge advocate for is I love the in-person or virtual trainings, but I also want to make sure, if possible, to get things down on paper, because that way we can have individuals be able to reference these things in the future. They might not need somebody there to walk them through or to remember how to do X, Y, or Z. So there's definitely going to be power in making sure that we actually have printed materials that go along with that.
Perfect. Thank you.
Yes, thank you. Any other questions on number one? Excellent. All right, moving on down to number two, the technology component. Assist with internet accessibility and assistive technology devices distribution. I'm going to be very honest and transparent and say this technology piece is not going to be something that we tackle in this first phase. And the reason is, it is very clear that devices are not covered under the CARES Act monies. It most certainly does not mean that we are not still pursuing this, because we are. It's just not going to be in the first rollout of the grants that we do, just given that it isn't reimbursed by the CARES money. So with that being said, we also taking a look at the internet accessibility. There is some still questions in regards to between March, I think it's March 27th, all the way to December. Oh, thank you. All the way to December 30th, can we look at having CARES Act money reimbursed for that time? but anything beyond the 30th of December 2020, it won't be. But we still are trying to take a look at further diving into the guidance manual to look at if the internet accessibility for this time would be covered. Taking a look at our devices such as tablets and Alexa and things like that. Hear me when I say it is not that we're not doing anything with that. It's just right now for this first phase, we aren't, because the majority of the items that fall in that category as solutions, unfortunately, isn't covered by CARES, but it most certainly does not mean that we will not look at that in our second rollout. Does anybody have any questions on that second piece? All right, seeing none, we'll move on down to that third piece. Small businesses. To assist and incentivize small businesses, which already are providing those services for seniors, and others to become more flexible with serving your seniors. So this is an example of, we have a lot of great businesses already opening up an hour before their typical hours of business that are allotted just for seniors. That time and the costs that have occurred within those hours and days are most likely able to be reimbursed by the CARES Act. And I don't want anybody to doubt some of the things I say, because when I say most likely, this is a fierce document. And I don't want anybody to come back and say, well, Commissioner Nelson said that this is covered. No, I'm relying heavily on our team of people who are really going through that guidance. It's a 4-page guidance. It doesn't seem too intensive, but let me tell you, there are some very tricky ways in which some of the things are stated in there. So we're trying to get more clarification on that, because the worst thing is going through with this process and finding out at the end, well, guess what? That wasn't in fact ever reimbursable. So we're really trying to be vigilant on making sure that does not happen. So when you hear me say most likely, there's a high possibility, but I can't confirm anything at 100%, but hear me when I say it doesn't discount that actually taking place. Again, oh, hang on, what's that, Cam? You're gonna be first to go again. And I think Commissioner Kowal.
Okay.
There are within this small business, maybe there's something that a small business is doing that is benefiting our seniors right now in this pandemic that we haven't thought of ourselves. That's going to be the glory of having a grant application that is kind of broad in nature. But rest assured, once we get those insight and information and ideas coming in of what businesses are doing, we'll be able to better take a look at whether or not that is something that is going to be reimbursable. So while we have an idea of some of the things we talked about with opening up early, or making sure, that they have other things in place, maybe delivery services. The sky's the limit for what information we could potentially get kicked back in these grants from small businesses.
Mhm.
Cam?
Well, I just like with the senior centers, it seems like the small businesses, whatever they're doing to I guess, make adjustments because of COVID-19, it could be, seniors will probably be rolled up underneath there. Because whatever they're doing usually would have a positive impact on the senior population as well. That's so again, it's some of the things. It sounds like we're specifically focusing on seniors, but the CARES Act is focusing overall on COVID-19. Am I correct?
Yes, and that's why I kind of prefaced that there's a lot of grants going on right now that really tackle a very, very, very broad idea of looking at how this CARES money is being spent.
Okay.
So you're absolutely right, Cam. A lot of the things, let's face it, a lot of the things that we've even talked about over the past couple of weeks, it's not just going to impact our seniors. It's going to impact everybody. But the idea is given that our seniors are our most vulnerable within this pandemic, it most certainly is a solution geared towards making sure that we're not leaving anybody behind, including our seniors, when we do take a look at how we can best protect businesses and people and our seniors as we do move forward with the reopening. So if you're confused at what I'm saying, you should be a little bit, just given that there are so many grants right now Oakland County is introducing and moving forward with. So rest assured, there's going to be an overlapping and a cross-referencing of a lot of these things that we're talking about and what we're also doing outside of this task force.
Yeah, what I'm thinking is, maybe raising the awareness of small businesses about seniors. Business is business, and seniors are a big part of the whole process, since we spend most of our money and our time in our own communities. So, I would think that businesses, it would be in their vested interest to do these things, especially if they can be reimbursed for some of the additional costs, like wiping down shopping carts,
Absolutely.
things that they have to do. That is over and above what they normally do. So I hear you.
I think that you make a good point too, Cam, in regards to, this all is at the forefront of our brains because we're talking about it. It doesn't necessarily mean that other people outside of this group are, aware of those things, which is going to be the power of all of us on this task force. And in addition to, there's some things that we can do from social media. And I definitely think, Barbara, is there potential looking at how we can have an outreach to some of our businesses to let them know that we are looking at, obviously, they're going to see the grant application, but it's going to be making sure that we put emphasis on that we actually have a grant that potentially could cover some of those services.
I'm sure we can, especially the small business grants are administrated by the Economic Development Department within us, within the county. So we can definitely reach out to them and find out, how they reach out with their small business grants.
And Barbara, maybe, I don't know if this is a possibility, but just given the 2 rounds of small business grants that we've already done, I wonder if it's possible to, and I'm sure that there were emails attached to many of those applications. I wonder if it's a matter of if we could do like a mass email to the thousands of businesses who previously applied for the small business loans or grants, I'm sorry.
Or we can do better, and if the task force agrees, we can ask the Economic Development Department to administrate those grants because they already have established a relationship and way of distributing. Just from the perspective of the task force, we are going to focus on different things. I think the first 2 rounds were focusing on employment and keeping employees, and these grants that this will come out from the task force will be focusing on seniors.
Excellent. Thank you. I appreciate that.
I believe Commissioner Cowell raised her hand as well. I'm
Yes.
sorry.
Commissioner Colwell.
Well, thank you. I had my hand raised because I was waving goodbye to my husband, but as long as I've got
Is there anything you'd like to say?
Yes, as far as the businesses go, I certainly agree that if there's any way that we can make the connection there, I just want us to be very cognizant of the fact that some of these businesses are going to go under and some are hanging on by their fingernails. I just don't want to do anything in any way to further burden these businesses. So we need to be very cognizant of that. And also, I mean, there was like an extraordinary number of businesses that applied, and in comparison, very few who actually got grants. So I'm not sure how it would be perceived if we reach out to everybody again, unless we're offering them something in return. Because if you're trying to survive and you apply for this grant, you didn't get it, and then you get an ask to do something, I'm not quite sure how I would feel as a business owner. I'd feel kind of, well, it's like, what the heck, I'm just trying to survive. Now they're asking me to do more. So let's just be aware of that.
I love the fact that you brought that to the forefront, because obviously we don't want that to happen. And so at the end of the day, any of these grants that we will take a look at doing is nobody has to do it, right? And I don't think that so far from the grants that we have done, especially with our small business grants, completely understandable that you don't want to rely on something and not get it or feel pressured to do something when in fact you just don't have the sustainability and resources to do that. So I definitely hear you, and I think that's a really good point to just keep in the back of our heads where, we're passionate people about X, Y, and Z, but there's other bigger fish to fry that's happening right now for a lot of these businesses. Not so much thinking about, well, how can I set my business up for seniors when I'm trying to worry about how I'm going to pay my employees to have the services in which we presently provide. So very, very well heard, Commissioner Colwell. Absolutely. Thank you.
There was a question, do we have a definition of small business, and if it's a standardized definition?
So when we were taking a look at this category, one of the things that came up was to take a look at the criteria that was put in place with the small business grants. Obviously, when you take a look at small businesses, we know that more times than not, it's our small businesses who have been hit really hard during this pandemic. So I think that the criteria that we put in place with the small business grants could potentially be a really great component to utilize in this small business. And I think we broke it down to, and don't hold me accountable for these words, but it was something like 0 to 5, 5 to 15, 20 to 30, 30 to 50.
Employees.
I'm sorry?
Employees, right?
Correct. Employees, yes. So does anybody have any thoughts, feedback, comments on taking a look at following that same small business criteria that was utilized with our small business grants that we've previously just done?
Maybe I can send those criteria to the task force members so they can review.
That would be great. That would be great. Thank you, Barbara. Cam?
Yeah, well, it seems like we'd have some continuity if there's already a template in place. Unless we think there's some reason to change, it seems like that might be a good start. It eliminates cross arguing. Okay, if we're all using the same guidelines, right?
Absolutely, I couldn't agree more, Cam. Keeping things consistent across the board. We had a really, really, really successful 2 rounds of the small business grants, and that process really was, I think, a fair process from the criteria that was created to the input that was given from local business owners and local government, as well as county commissioners who sat on those. So I couldn't agree more that was a process that seemed to work out very well. We had some great positive feedback with it, and I'm all about keeping things consistent when and if on all possible we can. So that's a
Ms.
great point.
Latoche has a question.
I'm sorry, Barbara?
Ms. Latoche?
Oh, yes, Ms. Latoche. Kathleen.
Oh, sorry. Hold on. Let me try if I can change something here.
What's the largest size business that would qualify?
Let's see. Barbara, I'm seeing if I can pull it up right now on my left.
Unfortunately, I cannot mess with the screen because I am presenter, so I cannot Google, but wasn't it under 500?
You know what? Let's see. I can...
Standard definition.
Let's see.
I thought it was under 50, but I might be missing the 0 then.
Okay, sorry. No, maybe I am completely off. I'm trying to use my phone. I cannot touch.
I think Commissioner Loobs is right on that.
Oh, 50? Okay. So 50.
When I talk, is there an echo?
No, you sound really good.
Okay, great. The reason I have the question is I just want to make sure that there's no way for someone to come back and say, oh, this was meant for small businesses and these large corporations took advantage of this. Likewise, there might be an organization that has like a 1 employee, but like a massive budget, we've heard these stories, and I just want to make sure that the money is going to get allocated the way we want it to.
Kathleen, I couldn't agree with you more in regards to making sure that we look and consider those. And the great news is that the criteria that was developed with the small business grants included that. So there was specific information in regards to their revenue in the past 3 years, how much money they've spent. So there was a really nice criteria utilized to really look at what businesses really need. This, and in addition to, one of the other qualifying criteria was that we wanted to know how new the business was. So was it a business that was opened in, the past 2 years or the past 5 years? And in addition to looking at what their annual revenues and expenditures were. Because at the end of the day, the one thing I can say is that our focus is our small businesses. Our small businesses are what really help generate our economy in our local communities. And it's so important that we make sure that we can help our small businesses out at any and every cost that we can, especially in light of the extra costs that COVID has created. But we're definitely, I will hopefully get some clarification on the max. But as Commissioner Lutz and Commissioner Kowal have said, I do believe it was capped at 50 as well. But we'll definitely get clarification hopefully before the end of this meeting. Does anybody else have any questions? Oh, you're very welcome. Thank you. Questions, comments on the small businesses number 3? All right, EJ.
Just one other thought that occurred to me today. I was talking with my parents' physician about this, and as things reopen, how do we connect them to the business? The doctor's concern was not so much about the facility itself and their control, but the transportation vehicle to take them from where they are to that other location safely. And it's outside the scope of this.
Love that. I know I definitely encourage all of you to watch our board meeting tonight, because some of these things that we're talking about are also going to be touched upon at our board meeting. And one of the things that we did talk about was looking at that senior transportation piece. It is definitely something that we've already started to have a conversation about in regards to how do we get our seniors into our communities that don't have any transportation. It definitely is something that we could take a look at fitting in our criteria as well. And in addition to, I do know that's going to be an area that is already being looked at and worked on.
Great, thank you.
Yeah, thank you. That's a great question. Barbara.
Yes, Commissioner Cowell and Loops were correct. So there are 3 categories: 10 or less employees, 11 to 20 employees, and 21 to 50 employees.
Perfect. Thank you, Barbara.
And just an update: the stabilization fund for small businesses. 79% of businesses with 10 or less employees had applied and get the grant.
Excellent. Thank you.
So majority, yeah.
Thank you, thank you. All right, is there any other questions, comments, concerns with number 3, the small businesses? All right, seeing none, we'll move on to our 4th one, which is our nonprofits. Assist and incentivize nonprofits to expand upon their services for seniors. A really great example of this is taking a look at those friendly assurance calls. I know, Barbara, thank you for sharing the friendly assurance calls that are happening throughout Oakland County. I do know that obviously there are extra costs that have occurred through those kinds of things. And in addition to taking a look at money that was spent on food, that's another big area to take a look at. And in addition to taking a look at of extra staffing in regards to having those reach outs with nonprofits. Again, most likely these items will be reimbursed, but again, at the end of the day, we're going to make sure that before we act on anything that we have without a doubt that these things will be covered as reimbursable. Again, kind of to highlight what Pam, you initially asked was, this is going to be a very broad grant in regards to, sure, there's going to be some very common sense things that people have already been doing, such as your assurance phone calls. But there might be something else that a nonprofit is doing that most definitely is under the reimbursable components of the CARES Act money.
Mhm.
Any, Cam?
Yeah, well, I'm thinking of like training. The other thing in nonprofits, which Jim will attest to, is vetting people. Okay, because of all of the scams and all of the other things that are happening, that to make sure that whoever is interacting with our seniors have been vetted, and that can cost you some money. Okay, so I mean, there's just a number of things. You know, you have a lot of people that want to help, and then you have some other ones that want to help and they have ulterior motives, and that's the downside. So, you know, our senior centers, the nonprofits, when they have to bring on more people and staffing, there are costs. So,
Absolutely.
yeah.
Absolutely. And again, these 5 things we're talking about today doesn't mean that there has been other conversations that overlap with what we're saying and new things that, you know, really aren't applicable, but potentially could be applicable to some of these categories. But at the end of the day, the idea is to start with a very broad grant proposal, because that way, like I said, I think that we've come up with some really great ideas, but at the end of the day, there's always a better idea out there that we didn't think of. So I challenge every person and organization that fits under these 5 categories to be creative and submit those things, because there isn't a guarantee of whether or not they would or would not be reimbursable. So just because we haven't talked about it doesn't mean there's something great out there happening right now. And hey, potentially it could be something that we could capitalize on. So the sky is the limit right now. But the idea is to start narrowing things down according to the Department of Treasury's guidance with that.
I'd like to ask a
Any other-
clarification question. This is Jim.
Absolutely, Jim.
I've heard a couple of comments from some of the senior high-rise buildings of low-income seniors that are operated by nonprofits, are trying to do some programming for the building members. If they wanted to make an application, would they fit under the senior center or the nonprofit sector, or does it matter?
So that's a really great question. At this point, I can't answer that, but it's not a bad I can't answer that. It's going to fall either under one of those or both of them. And you bring up an area that can get confusing then when you're like, well, I applied for something under the senior center, but should I apply for it under, let's say, the nonprofits? At the end of the day, there is a lot of money that is out there under the CARES Act. And to be honest with you, I encourage any and all nonprofits, senior centers to apply to at least one. If it's the wrong category, oh my goodness, most certainly I would think that in good faith, we would definitely make sure that information then would get under the correct grant. But at the end of the day, I think the best way to kind of think about this money is it's potentially going to be a little difficult to get this money spent because of the criteria that is put forth by the Department of Treasury under their guidance. So I don't want to say that to discourage anybody, but I say that to challenge of really taking a look at what expenses these organizations and nonprofits have been spending in regards to COVID. Did that answer
Okay.
your question?
Yeah, it sounds like it says it could be sorted out by the county once the applications are submitted if there's some application.
Absolutely. There's money out there and we want to make sure that we can use as much of it as we can. Is there any other questions in regards to number 4, nonprofits?
I have a question, Jim. So if they are nonprofits, do they know that today it was supposed to be released the grant application for the nonprofits administrated by United Way? Do you know about it?
I usually get the mailings from United Way, but I haven't seen that announcement come through on my email yet.
Okay, so the announcement was supposed to be, and please, commissioners, correct me if I'm wrong. Last week, board voted for $10 million to be administrated for nonprofit grants, and it will be administrated by United Way, and all nonprofits located and operating in Oakland County can apply for it.
You are correct.
If you want me to, I will definitely send information your way.
Okay, I'd appreciate that. And we received 2 United Way grants already, so I'm sure we're on their list, but.
This is not from United Way. This is from Oakland County, CARES Act money administrated by United Way.
Okay.
Our county exec is doing a Facebook Live event at 1:00 today in
About
Pratt.
it? Oh, perfect.
Yes, to answer any of those questions.
Barbara, is it
Say that again,
possible?
Commissioner Looms? I'm sorry, I didn't hear what.
Our county executive is doing a Facebook Live event at 1:00 today regarding the grants for the nonprofits. So
Thank you.
more, if you have questions, he might be able to answer that through Facebook Live.
Barbara, fellow commissioners, are you aware of, it would be nice to have maybe a document that talks about some of the grants that are already out there, with a potential, ending date of submitting. I think that, I know I'm a little confused. We're doing a lot of really great things, hearing when I say that, but we're doing a lot of things right now, just given that same thing that we're butting up next to is it's got a timeline. Is there anything out there, Barbara, that we have in regards to the grants that are presently out there?
Sure.
I'm on it. So I definitely
I will look
have
into it. I will look
a
into
good
it.
platform this evening to kind of inquire about that, because I think it goes back to there's money out there, there's grants out there, but if people don't know that these grants are out there and available, then it means nothing. And I know right now I'm learning that as we move forward with our grant processes, we will be very, very vigilant on making sure, as it was earlier discussed with our small businesses, that people are aware that these grants are out there and they will be aware of when the start date is and when the close of the grant acceptance dates are. Because at the end of the day, if people don't know these are out there, then we're not going to get people being able to submit their reimbursements potentially. So I'm on it, fellow task members, to get that information for sure.
And Commissioner Nelson, it's Marcia Gershenson. Can I just add that all that information is on the county executive's website, and that all the small business loans and grants are currently closed. What's still open is the PPE companies that can change their business model to start making personal protection items. But I'm under the impression that some of those grants may reopen.
Yeah.
So, we'll definitely get all that information. And then regarding it is somewhat confusing, the CBTs and then the nonprofits, but that will all be clarified as well.
Excellent. Thank you, Commissioner Gershenson. So as Commissioner Gershenson said, that information is out there, but I definitely think that we could do a better job at getting it a little bit more organized so we can, as mouthpieces from the county to make sure that we can convey where that information is easily. There's a lot of stuff going on these days, especially with the CARES Act money. And it's easy to get confused. I know sometimes I'm getting confused with all the great things that we're doing, but most certainly at the end of the day, all these great things that we're doing are only going to be great if people actually know that we're doing them. So thank you, Commissioner Gershenson, for clarifying that. All right. Moving on to our last one, number 5, our wellness health programs, assist with telemedicine services and expansion for those mental health services. I know, when we were having some prior conversations about this, one of the questions that I had when we developed this list was, Well, I love the fact that we can assist with telemedicine services, but how do we do that if people don't have access to technology to have those visits? So there is some things that we're taking a look at. Are there organizations and nonprofits who, you know, are already doing some things in regards to this technology piece with telemedicine? And there are some things going on. It's just getting better clarification on the accessibility and, again, the public awareness of that. But most certainly it's an area that, you know, the grant application is going to be broad and we can narrow things down. Does anybody have any additional thoughts on things that could fall under the wellness and health programs? I think somebody had said earlier about, or maybe it was our conversation with Commissioner Gershis, that doing some things online as far as working out, but I wonder if that does come into play with, you know, the things that have already presently been done, or the move to, you know, offering, you know, phone calls of, you know, support. Again, that might fall under the assurance piece, but if it's a medical professional, potentially that is something that can fall under that category as well. But definitely, I'm hopeful that within this category of wellness and health programs, that we're going to get some new ideas ourselves of what people are doing already out there. Cam?
Well, you're going to have some overlap in that with the senior centers, with the nonprofits, because, you know, Jim can tell you, you know, I'm a certified trainer in one of the AAA 1B workshops dealing with falling for seniors. So there's going to be an overlap in some of these things that I can see the wellness and health being the our medical profession, but then games, things that keep people, you know, one of the commissioners talked about a bingo game. You know, all of these things kind of all play in the, you know, they're interconnected, I guess is what I'm trying to say. So this one is almost like technology in some ways. Technology is somewhat dependent. And then some of the things are going to be the senior centers. It's going to be the nonprofits that also dovetail into that fifth objective is the way I see it.
Absolutely. I think that's a good point, Cam, because when we think of like mental health services, when we think of our older populations, it's making sure cognitively there's stimulation. Right. There's, you know, constant, you know, we know that memory is a component of this. And there are some great things that a lot of our senior centers are doing presently and have done in regards to, you know, exercising our brain. And a lot of times we might miss that, as those are in fact mental health services and programs. So
well, even the physical exercise stuff, Commissioner, I mean, they do a lot of aerobics, and there's just tons of things that go on at our senior centers that deal with the brain and the physical parts of a person. So absolutely.
So again, the information that we have in front of us right now is really taking a look at the things that we talked about and trying to put them into categories. So that way we can have a quicker process, a systematic process, but most certainly at the end of the day, if there's anything that any of you or you hear feedback from people in the community once we really start talking about these grants, and they have questions about, well, is this included or is that included? At the end of the day, I highly encourage, I'd reference that document by the U.S. Treasury Department, but I also too would still encourage them to still submit, because we don't know 100%. We're learning ourselves still right now, but rest assured, at the end of the day, our biggest priority is making sure that no money goes out to things when it's care related, that we don't have an idea whether or not it's going to be reimbursed. We want to be proactive and fiscally responsible when it comes to this money, because we do know that there is some criteria that we have to make sure that these things fall under. And I think we all know that sometimes, especially in government documents, there could be gray areas that we might need to further take a look at, but then other areas, it's very concrete. The tablets and the technology devices, it was very concrete. Doesn't mean we're not doing anything with it, but we know now that that cannot come from the CARES money.
Dr. Lawson is wondering if purchasing evidence-based curriculums and programming for senior health and wellness could be covered under the number 5.
I'm sorry, Barbara, can you say that one more time?
Yeah, sorry. Purchasing evidence-based curriculums and programming for senior health and wellness, if it can be covered by number 5 category.
So that's a good question. I'm trying to use my iPad right now and briefly look at the document, the guidance document. I'm not sure. I am not sure, but that's a really great example of something that we'll have to further take a look at because it falls within a. Oh, go ahead, Barbara.
There was a category for that it allows schools for schooling.
So I'm so glad you said that because that is what we're trying to get clarification on. It talks a lot about some of the things that we question with our senior population. It makes it very clear that some of these things are reimbursed or can be reimbursed if it is school related. So that's why, and it doesn't give any specific information to say that that's where the ball drops. So those are the areas where we're really still trying to take a look at, could it potentially be covered? At the end of the day, the one of the smartest strategies that I have been utilizing is, was this impacted due to COVID, the COVID pandemic? Was more money that was not planned to be spent on these COVID related costs? And even that is a very tricky question to keep in mind, but it does help kind of have a further conversation with yourself or others in regards to really taking a look at, was this something that created us to reach into our budget to be able to provide in light of COVID? Or, there are some thoughts of, well, in light of COVID happening again, are there things that we could do that we could sustain in the future past December 30th? So there are some gray areas still that we're trying to work out and through, but rest assured, there will be some things that we take a look at implementing as far as solutions in senior isolation and loneliness that will not be covered under CARES Act. And we know that. Like I said, our priority right now is to use the money that we have before we lose it.
Kathleen Latoche has a question.
Oh, absolutely. Kathleen,
you have a strange mark under your screen. So I don't know if I can unmute you. Yeah, unfortunately, this is.
I think her volume might be down.
No. If you have that white thing under your picture, sorry, Kate, can you maybe type your question or call in?
Okay.
Oh, it changed. Oh, hold on. Maybe I can hold on. Kathleen Latoche.
Okay, you should be able to hear me now.
Perfect.
Oh, there she is. Perfect.
I'm just gonna take this. I'm having audio issues. I apologize. So my question is really not about a particular category, but it's more about an overall question. And that is, we know that, I do a lot of work with the area agencies on aging, and we know that the Older Americans Act funds our area agencies on aging for older adults and typically sets priorities for those of greatest need, those most vulnerable, those of greatest social need, which includes low-income individuals, communities of color, LGBTQ older adults. And we also know that the COVID crisis is hitting African Americans disproportionately hard. And we also know that the old are least likely to have the knowledge and access to technology. So my question is, in what ways can we ensure that this CARES Act money is distributed in an equitable manner to those who are being hit hardest by this pandemic?
Kathleen, I absolutely love your question. And the very first thing I'm going to say is, please tune into our board meeting tonight at 5 p.m. a lot of the things that we're going to be talking about with looking at what there's $219 million of CARES money on the table here. So I know that we've already had some conversations of how do we look at directly utilizing information already, such as our lower income communities, our communities that have been hit harder with COVID, thus creating, more disparities, more costs. So aside from some of the things that we can do in this task force, I think that you're going to hear tonight a lot of information discussed on our lower income communities, our minority groups, and making sure that just like with our seniors, no one is left behind. The COVID pandemic has created a huge spotlight on the disparities between classes and races. And it is at the forefront of conversations of, just as with our most vulnerable populations, they are included in our most vulnerable populations, such as our seniors. And we are definitely having that be at the forefront of a lot of the decisions and proposals being put forth already outside of this task force in regards to looking at how we can make sure that our lower income communities and our minority groups are benefiting from the CARES Act monies. And some of the things that you're going to hear additionally tonight are some proposals that look at directly affecting people, the people in our communities. We know that small businesses are a huge component of this. We know that our organizations are a huge component of this. We know that looking at, solutions to better, connect people within our communities are solutions. But one thing that you will hear loud and strong tonight is looking at how we directly impact people, and more so people in these lower income areas and our minority groups.
Yeah, and I would submit that, frequently we talk about not leaving people behind, but as we talk about equitable distribution of resources, it's really, what is the proportionality? How do we look at what they call a targeted universalism approach? We know a lot of people need help, but some people need more help. And so how do we make sure that those resources actually go above and beyond to support those who most need them?
That's a great question. I can say that one of the things that we are taking a look at, and Commissioner Gershenson, Commissioner Kola, and Commissioner Leach, please feel free to pipe in on this. But one of the things that we are taking a look at, so there's a proposal that's going to come for the board tonight in regards to $30 million to our CBTs. And one of the pieces that we talked about we can't just go off of population, right? It doesn't matter. You could have a higher populated area, but they weren't impacted by COVID as significantly as maybe another community that doesn't have as high. So one of the things that we are discussing and talking about is it's not just population with this specific grant tonight that's coming forth with 30 million. It's taking a look at where was the largest impact of COVID. And what we know is it did hit our lower income communities and minority groups.
Southfield, that whole stretch.
Absolutely. That has been discussed, considered, and will be a part of the criteria of at least one of the grant proposals that we're putting out tonight. And in addition to, we're going to start to hear a lot more over the next 2 weeks, especially in regards to some more grants that are going out. And what you're going to find is they're getting more narrow in regards to our minority groups and our lower income communities that we know have been impacted higher than other communities.
And so the meeting tonight, you're proposing these 5 categories to the commission?
Good question. No. So 2-part, the information I just talked about with there's a 30 million CVT grant resolution that is going to be voted on at our board meeting tonight. A lot of the things that you might hear within that grant overlaps with some of the things that we've talked about today. Additionally, over the next few weeks, you are going to hear about Oakland County bringing forth more grant monies that deal with the CARES Act money that are going to be more specific to our minority groups, our lower income communities, that are going to look a little bit different in criteria than some of our other grants. I'm going to answer that second one after I call on Commissioner Kowal, because that's going to actually conclude leading into the next meeting that we'll have, and I'll have information on what the plan is now. What are we doing with this information? So if you
Okay.
don't mind, I'm going to hit to Commissioner Kowal, and then I'm going to come back to you, Kathleen, because that's an excellent
Okay.
question.
Sure, great, thank you.
Thank you. Commissioner Kowal.
Well, thank you, Commissioner. And just one random point I wanted to make in talking to my director for the White Lake Senior Center. She mentioned that ordinarily they have ARP as a tax program that they do for the seniors this time of year. So that's totally out the window. I don't know what we can do to kind of help out with that. There's maybe a dozen or so that do it at White Lake, but I guess Waterford gets a couple hundred of them. So I'll just toss that out there. I know there's a tax aid program too. But to this main point, and when I read this resolution, and it's $35 million that we're looking at distributing, I understand that there were certain CVTs that were more broadly impacted in a number of cases and deaths in relation to COVID. And to the extent that it costs, it was more costs as far as transport, things like that, because I know that there was some EMS and whether it's a fire department transports that were going on to that extent. But I would also like to say that I think everybody had to arm up for this pandemic, and everybody had to spend quite a bit of money in preparing and keeping their citizens safe, whether or not they had as many cases as others. So I certainly hope, and we're going to have more ongoing until the end of the year. So I hope that is also kept in mind as well, that you don't know if it's coming at you or not, and so you prepare for it. But I will say that Waterford Township, I hope that since it's the Waterford Regional Fire Department now, and they also service Pontiac, well, I hope that's taken into consideration as well. That's all I
Absolutely. Definitely heard, and it's good information to share and say. And like I said, there's going to be multiple grants that you're going to see Oakland County be bringing forth in regards to COVID expenses. And at the end of the day, the one thing, Commissioner Cole, I hear you 100%, but I also know too that when you do look at some of our lower income communities and communities that are heavier within our minorities, there are significant costs as well. And they might not have a high population. They might have a high population. At the end of the day, it's important that we do make sure that the groups in the communities that were hit the hardest, regardless of, race, class, everybody has been hit by COVID. But most importantly, hear me when I say there are other areas within our communities and other minority groups that have been hit harder. You might not feel that some of the things that we talk about, as Kathleen, you highlighted, hit some of those minority groups specifically outside of the senior realm. But hear me when I say there will be grants that we will be putting forth that make sure that we are taking a look at our hardest hit communities, whether that's lower income, whether that's minority groups. There will be specific grants that narrow in a more very specific category of individuals and communities that have been impacted, for sure. Is there any other questions, comments in regards to the 5 items?
Oh, just a quick follow-up about the meeting tonight. So you were suggesting we tune into that. Is there going to be an opportunity? Is that really so that I can listen and school myself up? Or is there also an opportunity for people to weigh in and share their, input?
So there will be our public comments section, right? So it's kind of set up the same format that we have right now. It's just a different format platform that we use. It's not, actually it is GoToMeetings. I take that back. Sorry, I'm like on 5 different platforms. But it will be set up very similar to this. You won't be able to sit in camera-wise, but you will be able to speak on public comment. All of our documents are available prior to the board meeting, so you will be able to see what is going to be talked about. So at the beginning of the meeting, when we do open it up for public comment, please do feel free to ask questions that we will be voting on and discussing in the resolutions that will be introduced and coming forth to the board, in addition to some of the resolutions that we will be voting on. But I definitely encourage you, get familiar with the agenda items that will be able to better help gauge then some of the questions that you might ask. There is no wrong question. So go in at it with asking as many questions as you would like. And like I said, there is no silly question. So ask away for sure. And we also have a board meeting slated for next week. That'll be in the morning. But tonight's board meeting does start at 5. Any other questions, thoughts, concerns on the 5 items? Okay, I think I got everybody on my screen now, so I hope I'm not missing anybody. Okay, to go
There
back to
are
what
people on the phone, but I don't think so. Representative Menugian is on the phone, but I don't know if I don't see.
I'm here. I'm good. I've been listening intently and don't have any questions at this time.
Okay, thank you, Representative.
Okay. So as we move forward, it's one of the things that we're going to do first is obviously look at which out of these 5 categories can we start to implement first. I think there is some, we might take a look at any suggestion that you guys, we have along the way. We're going to be re-meeting. My idea is first and foremost, I'd like to have a meeting scheduled for June 25th. That allows some time to take a look at creating the grant proposal resolutions. And in addition to, like I said, we already have gotten some other grants and proposals that are going to be coming forth to the board. The good news is the structure of the grant process with COVID CARES money is going to be very similar. So with that being said, over the next 2 weeks, one of the things that we're going to be doing is drafting our first resolutions to take a look at what are the things that we can do right now. And it really does take a look at there's a variety of things of the senior centers, the small businesses, the nonprofits, and the wellness and health programs all seem to be the categories that we can act on relatively quickly and now. One of the things that we might take a look at is we might look at, potentially merging 1 or 2 of these together to make it a broader process, but AKA it's to expedite this position and getting this money out to our communities as quick as possible. So the idea is by our June 25th task force meeting is to present to the group our first rollout of a potential resolution or resolutions that would then go to the board meeting in July on July 8th. So my idea is to have substantial, pretty finalized grant proposal resolutions in place by that June 25th. Commissioner, Kowal, Commissioner Markham, and myself will be the ones taking the vote on that. But the input that everybody in this task force has will be important as we do that. And the idea is then to butt up to that July 8th board meeting that we already have scheduled, and then have this be introduced at our board meeting. And basically what I think, and Barbara, correct me if I'm wrong, that the process then would be, we would refer it to committee to be voted on. So my idea is, in the backs of your head, July 8th is an important date for our first rollout task of grants in this task force. Like I said, the next 2 weeks are going to be spent on taking a look at is it feasible to take some of those 5 categories and put them into one, make it a little bit broader, knowing that we've got some overlap. The other thing that works to our advantage in the task force is there's already a lot of work that has been dedicated to putting these grant proposals together as it is as far as the structure and the criteria. So given that, we already have a really good framework that we can utilize. And in addition to adding in, other, pieces that we deem is more appropriate and fitting to the task force. But the idea is by June 25th to have information to present to this task force in regards to our first rollout of approaching the board on introducing. questions, comments, concerns on that chunk of information?
I just want to let you know that I uploaded the framework to the Google document, but if I can also email it as well.
Excellent. Thank you, Barbara. And two, you will see, attend the board meeting tonight and you look through the packets, the structure that you see within some of the grants geared for the CARES Act money is going to be very similar to the structure that we'll use for our grants as well for this task force.
Clarification question for the July 8th action. Is that a resolution authorizing the county to engage in a grant-making process, or is that approved grants that have already been submitted?
Good question. So the idea of the July 8th board meeting is to bring forth and introduce a grant resolution specific to this task force. Once it is introduced at that July 8th meeting, I believe it's just the following week. We tend to rotate off on committee weeks and board meeting weeks. So the week after that July 8th board meeting will be when that resolution goes into committee. And I'm guessing it's going to go, Barbara, into the healthy communities, healthy environment.
Human services, yeah.
Or human services, new name now.
There is also possibility that we have goals and time frame, but that it can change. I have heard that there might be more frequent board meetings and committee meetings. So we can aim for July, but it doesn't have to be that the grant will be approved by the board sooner than end of July.
Barbara, I love hearing that. So basically what I'm hearing you say, Barbara, is that July last resort time frame, because we potentially could have it sooner. But rest assured, I think especially tonight's going to be a good move forward with taking a look at what Oakland County expectations are with the CARES Act monies, which will help lay that foundation for us as we move forward. Because like I said, a lot of work and a lot of time and a lot of departments have spent some time already on this with some of the other grants. So I don't foresee there being too many bumps or barriers as we proceed with formulating our own grants and resolutions pertaining to this task force specifically. Sir, any questions, comments, concerns about the information that we talked about today? Okay, I just want to end by saying we could not have gotten this far without all of you and everybody a part of this task force, because it is so important that not only, to assemble a group of people who are crucial and experts in these areas. And as you see, we have multiple different representatives from multiple different areas. And I'm so grateful for your time, but most importantly, I'm so grateful for your willingness to provide, solutions and brainstorming. And as we continue to move towards and forward in this process, there will be new things that you'll think about. Please share them. Share them, because we are trudging on some new waters with the COVID pandemic. We know that there is a possibility of a resurge. There's so many unknowns that are out there, but I also want everyone to know that don't cap your thoughts and wishes and solutions to looking at how we better can serve our seniors, especially in a time of so many unknowns. I think I want to be proactive as much as possible as we do look into the future. But again, thank you for your thoughts and your solutions and your willingness. I'm going to come to, oh yeah, you're going to clap it, then I got, yeah.
Just a question.
Definitely thank you. Cam?
Our next meeting is going to be Thursday, June the 25th at 11:30, correct?
Correct.
All right.
The next task force meeting, June 25th.
And I just have one question. I am not sure if we have to, but just in case, can we receive and file the document that I posted on the website? I am not sure if we have to, but just.
Excellent. I'll make a motion to receive and file the document. Support by Commissioner Lubes. Thank you. And Commissioner Koval. All those in favor signify by saying aye.
Aye.
Thank you. Sorry, maybe it's not necessary, but I'm just.
You know, between task forces and special committees and actual committees.
And actual clerks, that, you know, we could use one.
Absolutely. So again, thank you everybody for your time today. And I am that you're excited moving forward because it's time to execute some of these short-term solutions and get some things going for our seniors that are only going to enhance not just the quality of life, but their ability to connect with people in their communities and their healthcare professionals. And at the end of the day, we are all in this together. It's something that, you know, unites us all in the sense of we're all, you know, trudging on some new territory. So as we move forward over the next couple of weeks, if you have ideas and you have thoughts, write them down, email me, let us know, because this doesn't just stop here in between today and our next meeting. So please feel free to pipe out information to myself or any other, you know, member, commissioner, our wonderful Barbara, who has really just been a saint in making sure that we've got information being spelled out for everybody and accessible. So if there's no other further business to come before the committee, then I declare the meeting adjourned at 12:55 p.m.